Hey guys, this is Dr. Hub. Today we'll look at the bladder carcinoma. And under the bladder carcinoma, we're looking at the etiological factors. So to begin with, there is a transitional cell carcinoma. So this transitional cell carcinoma is nothing but the urothelial. So what are the risk factors in this case? The risk factors will be smoking. Next, there is also the exposure to the alanine dyes. So exposure to the alanine dyes, and there is the cyclophosphamide, and also the pelvic irradiation. Next comes the squamous cell carcinoma. So squamous cell carcinoma, the risk factors is the schistosomias, that is from the S. hematobium. Then comes the chronic irritation. There is chronic irritation, and this is caused by the stone disease. There is also presence of the bladder diverticula and the chronic UTI, and also smoking. Next, there is adenocarcinoma. So adenocarcinoma includes the persistent urachus. So in case of squamous cell, it was schistosomiasis. There is chronic irritation caused by stone, there is bladder diverticula, there is chronic UTI, and the smoking. In terms of the adenocarcinoma, it is going to be the persistent urachus or the trigone of bladder. This trigone of the bladder. Next, there is congenital bladder extrophy. This congenital bladder is the extrophy. Next, we look at the inherited cancer syndromes. There is inherited cancer syndromes. So this includes, there is Lynch syndrome. There is Lynch syndrome. There is also the hereditary retinoblastoma, as well as the Costello syndrome. This Costello syndrome. Next, we look at the acquired genetic mutations. So under the acquired genetic mutations, there is a gain of function. There is gain of the function, and this is of the mutation in the FGFR3 mutation. Next comes the activation of mutations, and this is of the RAS and also the PI3 kinase. Next is the disruption, and this is a disruption of the P53 as well as the RB genes, and this is in a muscle invasive cancer. Muscle invasive cancer.